Dr. Ahrens, type 1 diabetes, and how does this affect weight loss?
Our first animal study with type 1 rats, these were rats that had no functioning pancreas. They were type 1s. That was our first study, and we not only kept those rats alive without a functioning pancreas, but it reversed the type 1 diabetes. There's just hardly no way around it. We appear to be rejuvenating beta cells. That means that there's endogenous production of insulin after taking products such as Emulin. I can say, yes, I'm certain it helps type 1 diabetics, and I have given it to my own relatives that have type 1, but I do not have the clinical study to back that up. You've got nothing to lose. It's not going to hurt you. It's not going to interfere with anything. As far as weight loss goes, there is a direct correlation between blood sugar levels and weight. You might have a little too much sugar in your blood, and insulin is going to look to put that into fat tissue. So we inhibit that action. We get the sugar to be burnt up in muscle tissue and also into your brain. So the result is you feel energized, you feel bright, and you'll start losing some pounds.
Now, on the iGalen website, it says pregnant women and breastfeeding women can take Emulin.
If people that follow my discourse here, I think this should be in everyone's diet. I don't care who you are. It's just like a vitamin. So, yes, there is no problem. Type 1 diabetes happens because the fetus is flooded with refined sugar. If you are predisposed genetically to getting diabetes and you get flooded with refined carbohydrates in the womb, you're going to get type 1 diabetes. If it happens when you're an adolescent or a young early adult, you're going to get type 2. And eventually, if you keep it up your whole life, you're going to get diabetes type 3, which is, you'll Google that, you'll find out that's Alzheimer's. It's been called type 3 diabetes since around 2007.
Dr. Nelson had asked about the sports performance.
Well, Emulin causes efficient carbohydrate management. So without Emulin in your bloodstream, you are at a great disadvantage. To be less of a peak. There's still a peak when you load up with carbs. You get a peak, and then you get an overcure, a swing, overcompensation, and then you get that lull, that crash. Right. Emulin, one of its main functions is to smooth that curve out and make it longer lasting and lower. So you feed your body with that carb at a nice even rate.